What motivates me to come to work every morning is the patients that I get to interact with. They're counting on me to be here, to bring my best, and I'm motivated to walk with them in their journey. My name is Dr. Michael Kaplan. I work for B Physical Therapy. My educational background involved an undergraduate degree in clinical health sciences from the University of Central Florida, and then I went on to do my doctorate degree in physical therapy from Florida Gulf Coast University. There were a few different moments in my life that led me to entertain a career in physical therapy. The first was I received a pretty severe shoulder injury when I was in high school playing football. I had to have surgery for that, and then went through physical therapy myself and had a great outcome, a great relationship with my physical therapist, and made a ton of progress. So it was always something in the back of my head that it could be something that I wanted to do. One thing about physical therapy that I'd like people to understand, really pertaining to all ages, is that strengthening exercise is something we should do for the entirety of our lives. It's so important from a systemic standpoint, but also extremely important for preventing injury, preventing falls, and not just strengthening exercise in general, but specifically high-intensity exercise. Research has shown now that the importance of doing that, even in the later stages of life, can really help with decreasing risks for injury related to falls, but also other types of ailments and diseases. You have to think in a broader term of just healing from the individual injury. Oftentimes there's systemic processes that can lead to a system that gets injured. And sometimes it's more of an acute situation that heals quickly. But in more complex situations or chronic situations, it's oftentimes looking big picture. And in order to heal from something like that, it often takes somebody in the healthcare field walking alongside you and guiding you, and eventually empowering you to take steps that are necessary to improve that system and eventually heal. My specialty involves everything from advanced outcome tests and measures and treating everybody on the spectrum of physical capabilities, so various neurological ailments as well as different types of arthritis and pain diagnoses and balance impairments as well. Some of the procedures that I include in my practice in physical therapy here in Lake Mary are dry needling, spinal mobilization and manipulation, and different types of manual therapies, including soft tissue mobilization, as well as corrective exercise. And that's really the hallmark of what we do, is progressive corrective exercise to get people stronger and feeling better. The most important core value to me is making sure everyone that walks in to this clinic and interacts with me leaves with a sense of hope, that they feel that this is a place where that they can improve, that they can achieve their goals and feel better. When someone leaves this office after a session with me and they feel that, I feel that that is a win.